Welcome back to our second health education video. We will be talking about typical dialysis medications and drugs to treat high blood pressure and diabetes.
The kidneys are involved in so many different bodily functions that it is impossible for dialysis to replace everything a healthy kidney can do. Besides going for dialysis treatments and following the dialysis diet, there are medicines that help maintain a higher quality of health for a longer possible time. Anemia occurs when a person has a low red blood cell count. Anemia causes fatigue or tiredness, lack of energy for exercise, difficulty in concentrating, and strain on the heart. Erythropoietin is responsible for keeping a normal amount of red blood cells in your body. Since the kidneys make and secrete the hormone erythropoietin, nearly all patients who are on dialysis have anemia. Erythropoietin is typically available by injection during dialysis. In order for erythropoietin to work well, iron needs to be in the body to make red blood cells. Without iron, you can't make good red blood cells and are not able to carry as much oxygen. Many dialysis units now give small amounts of intravenous iron during hemodialysis. Patients on dialysis can experience loss of minerals in bones like calcium and phosphorus. The calcium and phosphorus can also mix together in the blood, get hard, and build up in the small blood vessels of the feet, intestines, and heart, causing amputations, abdominal pain, and heart failure. Because of kidney failure, the kidneys can no longer get rid of extra phosphorus that's in the blood. Preventing or reversing this process can be done through diet, dialysis, and medicines such as phosphate binders. Calcium acetate, also called Foslo, and Renvela are commonly used phosphate binders. However, patients should be careful as some of the calcium from these binders is absorbed into the bloodstream and might deposit in small blood vessels, causing organ damage. Active vitamin D is necessary in maintaining bone health. Vitamin D is usually given to dialysis patients by IV during hemodialysis.
After diabetes, high blood pressure, also called hypertension, is the second leading cause of end-stage renal disease, causing more than 15,000 new cases of end-stage renal disease in the U.S. every year. Blood travels away from the heart through special blood vessels called arteries to all parts of the body. The pressure of the blood against the walls of the arteries as the heart pumps is what is measured. The blood pressure measurement has two numbers, a top one and a bottom one. The top number, systolic, is the pressure when the heart pumps out blood. The bottom number, diastolic, is the pressure when the heart relaxes before the next beat. When blood pressure is high and left untreated, it can damage the blood vessels that carry blood throughout the body. The smaller blood vessels are the ones usually affected first. Kidneys have small blood vessels that become damaged by high blood pressure. This can lead to chronic kidney disease. Most people with high blood pressure do not know they have it because they don't have any symptoms. Unfortunately, a heart attack or stroke can sometimes be the first sign of a problem. The only way to know if your blood pressure is high is to have it checked by a healthcare provider. A blood pressure reading lower than 120/80 is desirable. A person's blood pressure is considered high if the top number is higher than 140 and the bottom number is higher than 90. Many people with high blood pressure need medicines to help lower blood pressure, which also helps to slow the progression of kidney disease. Two groups of medicine that lower blood pressure are angiotensin converting enzyme inhibitors, also called ACE inhibitors, or angiotensin receptor blockers, or ARBs. In ACE inhibitors, angiotensin 2 is a chemical in the body that narrows blood vessels by making the muscles around the blood vessels contract. It creates a chemical called angiotensin 1. ACE inhibitors prevent angiotensin 1 from creating angiotensin 2. This helps the muscles around the blood vessels relax and enlarges the blood vessels, which helps reduce blood pressure. ARBs, on the other hand, block angiotensin 2 from causing the muscles around the blood vessels to contract and make the blood vessels smaller. ARBs protect the blood vessels from the effects of angiotensin 2 so that blood pressure stays in a safe range. ACE inhibitors and ARBs lower blood pressure, which also helps to slow kidney damage. Some people may need to take a combination of two or more blood pressure medicines to stay below 130/80. Sometimes other medicines are needed in combination to get the blood pressure down to a healthy level. The following are commonly used drugs for treating high blood pressure. A2R antagonists can be used if ACE inhibitors cause side effects. However, they require a blood test to monitor side effects. Calcium channel blockers can be added to therapy to further reduce blood pressure. However, some may cause a rapid heartbeat, swollen ankles, constipation, headache, or dizziness. Diuretics rid the body of excess water, helping to reduce blood pressure. Potassium-sparing diuretics prevent potassium loss in the body. They can be prescribed alone or in combination with another diuretic. Beta blockers reduce the heart rate and the heart output of blood. Some beta blockers cause insomnia, fatigue, depression, and cold hands and feet. Alpha blockers are used as a second or third drug to further reduce blood pressure. Finally, centrally acting drugs may cause side effects but is safe during pregnancy. The following lifestyle changes may also help control blood pressure by maintaining weight at a level close to normal by eating fruits, vegetables, grains, and low dairy foods, limiting daily sodium intake by avoiding fast food, which is high in salt, exercising for at least 30 minutes a day, avoiding drinking too much alcohol, which is 2 drinks for men and 1 drink for women per day, limiting caffeine intake, and stopping smoking.
Many patients on dialysis have diabetes. Glucose is a major source of energy for the cells and muscles and tissues, including the brain. For glucose to be utilized by these cells, insulin, a hormone secreted by the pancreas, is necessary. A person with diabetes either does not make insulin or is resistant to the insulin in his or her body, resulting in high blood sugar levels. People with type 2 diabetes make insulin, but their bodies are resistant to it. Treatment usually comprises of oral diabetes medications, insulin, diet, or a combination of these. The most common medications include sulfonylureas, dipeptidopeptidase inhibitors, and biguanides. Sulfonylureas stimulate the pancreas to secrete more insulin. Glipizide is the most commonly used oral medication in patients with advanced kidney disease. The most common and most dangerous side effect is low blood sugar. Low blood sugar can be recognized by signs of fatigue, sweating, tremors, dizziness or lightheadedness, nausea and vomiting, or even slurred speech. Dipeptidopeptidase inhibitors, such as Januvia, lower blood sugar levels by increasing insulin secretion from the pancreas and decreasing the amount of glucose that is produced by the liver. Common side effects include headache, runny or stuffy nose, sore throat, upper respiratory infection, nausea, and upset stomach. Biguanides, such as metformin, work by decreasing the amount of glucose that is produced by the liver, stimulating the pancreas to produce more insulin, decrease the body's resistance to insulin, and increase the amount of glucose absorbed by muscle cells. Metformin should not be used in hemodialysis patients because it increases the risk of lactic acidosis, which can lead to death. Thank you for joining us again today. I hope you learned something about how your medications work. Next time, we will be discussing hemodialysis and lab work.
The one essential thing is that we strive to have light in ourselves. When people have light in themselves, it will shine out from them. Albert Schweitzer.